Chair, we're ready to go.
Good morning, councillors, officers, members of the public and press. Welcome to this meeting of the Health and Wellbeing Board. This meeting is a remote meeting and it's being live streamed on the website and recorded. I'll now hand over to the Democratic Services team for a roll call.
Thank you, Chair. We'll begin the meeting by way of a roll call of all those in attendance remotely, and may I request members to confirm they have a copy of the agenda and can both hear and see councillors in the meeting. I will now begin the roll call. Councillor Buchan?
Yes to all.
Thank you. Councillor Moore? Yeah. Councillor Thomas?
Yes.
Thank you. Councillor Ward?
Yes to all.
Dr. Timlin? Dr. Timlin? No, not at the moment. David Gallagher? Or Michael Houghton? Just leave that for now. Craig Blundred?
Yes to all.
Thank you. Sally Robinson?
Yes to all.
Thank you. Jill Harrison? Don't think we have Jill as yet. Christopher Akers-Belcher as substitute for Margaret Wren.
Yes, present, and I have all the papers.
Thank you. Denise McGuckin.
Yes, present and have all the papers.
Thank you. Tony Hanson.
Thanks, Denise, and yes, I've got everything.
Thank you. Danielle Swainston.
Hi, Denise. Yes, I've got everything.
Thank you. Tim Butler.
I'm here. Thanks. Yes to everything.
Thank you. Tracy Woodhall. Or do we have a substitute for Tracy Woodhall? Nicola Hagan? No, not at the moment. Dominic Gardner. Peter Graham.
Morning, and yes to all.
Is that on behalf of Superintendent Sharon Cooney? Thank you. Fiona Adamson.
Morning, yes to everything, thanks.
Thank you. Sonia Black.
Morning, yes to everything.
Julie Gillen. It's the North Tees and Hartlepool NHS Trust rep. No. Councillor Hall as observer. No.
Denise, sorry to interrupt. Nicola Hagan is here for Tracy Woodall.
Oh, thank you. Yeah. We also have invited today was Councillor Brewer, who's already a member of Health and Wellbeing. Councillor Little from Adult Services Committee. Sue Little. I know she was with us earlier. Are you there with us at the moment, Sue?
I am, and I've yes
you.
to all.
Councillor Prince.
Hi, yes to all, thank you.
Thank you. Councillor Carl Richardson.
Yes, I can hear everyone, but I still haven't got the papers yet. I'm on adult services.
I think we're organising for the link to be sent, Carl.
Okay.
Yeah. Councillor Thomas is already in. We've already got included, yeah. Councillor Ward is already included as part of the membership, and Councillor Young. I understand Zoe Sherry is a representative for the presentation, the mental health presentation from Health Watch is also present.
Yes, I'm here. I can see, but I haven't any papers.
Okay, thank you. I also have Councillor Tony Richardson in attendance.
Yes.
And can I also ask, is there any members present that I've not called?
Yes, Denise. Brenda Harrison.
Oh, thank you, Brenda.
Good morning, Denise. Neil Harrison, Head of Safeguard and Specialist Services. And Dominic Gardner, I think, has just joined the meeting as well.
Oh, excellent.
Hi, Denise. Jill Harrison. Apologies for being late. I was struggling to join.
Okay, thank you, Jill. Is that everyone? Yeah.
Hi, Denise.
Yes.
Sorry, I'm Darren Best. I'm the independent chair of the Safeguarding Board.
Oh, yeah.
I wasn't sure whether to say I'm not a member as such, but I'm here as a guest.
No, that's great. Are there any other guests that I've not mentioned?
Denise, just picking up, I've put in the comments, it's Karen Hawkins, I'm representing Dave Gallagher from the CCG.
For David Gallagher. Thank you, Karen.
Hi, it's Jo Heaney. I'm presenting from the CCG on the neurodevelopmental paper on behalf of Alex Sinclair.
Right, that's great. Is that everyone? That now concludes the roll, Chair. Thank you, Chair. Just over to apologies. I don't have any apologies other than the ones that have just been recorded.
Okay, thank you. I'll just at this point just welcome Sonia Black. I think this is your first meeting, is it, Sonia, as the new head teachers representative? So welcome to the board.
Okay, thank you.
And also for the record, in your paperwork, it refers to Craig Blundred as the Acting Director of Public Health. Since the publication of those, Craig has been appointed as the Director of Public Health at Hartlepool Borough Council. Okay, any declarations of interest by members for agenda items today? Councillor Ward.
I'm just going to cover myself anyway, and just I'm a holistic practitioner for Alice House Hospice. So just in case there is anything sort of goes into that area, I just want to make sure I'm covered for that.
Okay. Thank you. And Councillor Thomas.
My usual declaration as a employee of Healthwatch Hartlepool, but also today I'm also the mental health champion of Hartlepool Borough Council.
Great, thank you very much. Okay, if we look at the minutes then, can we confirm the minutes held of the meeting, held on the 7th of September? Are there any questions or comments on those minutes? I'll just give you a minute to check over those if you haven't already. No issues. Okay, if there's no dissent, we'll take those minutes as a true record, and then we'll look at the meeting notes, of the Outbreak Control Engagement Working Group held on the 5th of October. Again, any questions or comments in relation to those? No? Okay. If there's no dissent, again, we'll take those as a true record. Thank you. So, is Jill Harrison with us yet? Is she still? Oh, she is. Okay, great stuff. So we'll move on to agenda item 4.1 then. That's the Tees-wide Safeguarding Adults Board annual report, and that's Jill Harrison and Darren.
Thank you, Chair. Members will be familiar with the fact that it's part of the governance arrangements for the Tees Safeguarding Adults Board that the annual report is presented to the Health and Wellbeing Boards in each of the 4 local authorities. So previously, members will recall that Anne Baxter, the independent chair of the board, has attended to present this report. Since the last report, as outlined in the covering report today, Anne has retired from that role, and we've been through the recruitment process to appoint a new independent chair, and I'm really pleased to see that Darren Best, our new chair, has joined the meeting today. Darren's joined as an observer today because the report actually covers the period prior to his appointment, so we thought it was more appropriate for me to present the report on this occasion. But obviously Darren will attend future board meetings to present the report and to take any questions from members. So the report obviously has been presented with the papers, so members have had an opportunity to read that, and a number of the representatives on the Health and Wellbeing Board are obviously also involved in the Safeguarding Adults Board as well. So I won't go through the report in a great deal of detail, really just to highlight to members there's been an awful lot of work done in the last year to raise awareness of safeguarding adults issues, and in particular the board's developed the role of safeguarding champions, which has been a really positive development, and we've had lots of interest from a range of different partners in being part of that network. We've also done a significant amount of work over the last year in relation to self-neglect. which is a theme that's increasingly prevalent in safeguarding issues. And we've had an annual conference regarding that, and some really positive developments in terms of training and work that's been done to support practitioners who were involved in those cases. The other area where there's been a significant amount of focus is really around overlap with other reviews, so domestic homicide reviews, and some really key themes that have arisen from that in terms of things that we're seeing in multiple reviews, and that's really in relation to domestic violence and substance misuse, and some of those very challenging cases that affect multiple agencies. So there will be an increased focus again over the next year on how we work more collaboratively with other safeguarding and statutory partnerships, so the Safeguarding Children's Boards and the Community Safety Partnerships, to look at how we can collectively work on tackling some of those issues. The way that we've done that locally is through the team around the individual approach, and there's an article on that in the annual report on page 13. I'm really pleased to say that that process is working well and has now been rolled out and adopted in the other 3 local authority areas within the Tees patch. So that's really just a couple of highlights from the report. I'm happy to take any questions and also invite Darren if he wishes to just say a few words of introduction. Thank you, Chair.
Thanks, Jill. Yeah, hello everyone. I know I've met some people on the call before. By way of a very brief introduction, I actually took up post on the 22nd of October, so I haven't actually chaired an adults meeting yet. I actually chair my first one on Wednesday this week, but I'm busily trying to get around as many people as I can and having conversations about the adult safeguarding agenda. My background is one of policing, and again, for those who are involved in the children's agenda, you'll know my old boss, no doubt, Dave Pickard, when I was in Cleveland. But I served for 30 years in the police, 26 years in Cleveland, and my last role, I ended up as being the Deputy Chief Constable up in Northumbria, so covering that huge geographical area up there. And as well as taking on this role, I'm a non-exec director with the CNTW NHS Foundation Trust, so mental health trust, that's based up in Gosford, and again covers the same area as Northumbria Police, plus a bit of Cumbria. But the things Jill has already said around the adults agenda, I'm really keen to explore how we can work more closely with existing boards such as the Health and Wellbeing Board, but obviously the Children's Partnership, Community Safety Partnerships. And I think the other important thing for me to say at this stage is that the board, the Adults Safeguarding Board, covers the whole of Tees. And having worked in Cleveland in the police for 26 years, I'm very alive to the differences that exist in each local authority area. So although it's a Tees-wide board, I am keen to make it as bespoke as possible, so we take the strength of the 4 local authorities working together, but equally recognise the independence and the unique nature of each of the 4 local authority areas that we have across Tees. And I've worked Hartlepool some time ago now as a uniformed sergeant, as a uniform inspector, so I know the patch reasonably well. And yeah, so happy to answer questions along with Jill, and I will present the report no doubt next year to cover a period that I've at least got half of that year's tenure under my belt. Thank you.
Great, thank you, Darren and Jill. It's great to see, to be honest, some positive numbers and also some good work being carried out despite all that's been going on this year in the report. And as always, I'd just like to thank those involved in the board and for everything that they've been doing. Are there any questions or comments from members for either Jill or Darren at this point? Councillor Thomas. You're still muted, Councillor Thomas.
Sorry. Firstly, just to welcome Darren into his new position and look forward to working with him in the months and years to come. I think secondly, it's I think only correct and proper for us to place on record our thanks to Anne for the work that she did as Darren's predecessor. as I really do think that Anne moved the adult safeguarding agenda on tremendously during her time as chair of the Tees-wide Adult Safeguarding Board. But I think as far as a question goes, I think the one that really jumps out is looking at the priorities for 2021 and moving forward. And I think, as you mentioned, Chair, these have been quite extraordinary times that we have been living in over the last 9 months. And I think whilst there is some light possibly at the end of the tunnel, I think we have got some difficult times ahead, which are really going to impinge and impact upon safeguarding as an issue going forward. And I think certainly the way in which safeguarding has happened in the past, a lot of the information that has come to light because of people observing things, seeing something that isn't right, the opportunities to do that, I think, haven't been there in the same way over the last 9 months, and certainly moving forward for some considerable period of time probably won't be there in the same way for some time to come. So I think one of the things for priorities for 2021 and moving forward is thinking about that different environment in which we are working in, thinking about how safeguarding alerts are raised, and thinking about the more virtual world in which we are living in and how that's going to impinge upon safeguarding activity going forward.
Jill?
Thank you, Councillor Thomas. It's a really valid point, and it's certainly something that we've been considering as the statutory partners of the board in terms of the impact that COVID's had. Obviously, this annual report covers the period prior to COVID, so we do recognise that the world feels like a very different place now, and there certainly has been significant impacts in a number of different areas. So we did see a slight reduction in safeguarding alerts at the start of this period, which that's now back to normal levels. But there were some areas where we did see particular increases around domestic violence, which was something that was highlighted nationally. And we do recognise that things do feel very different now. We've been doing some work as the board, as a task group, specifically about issues for care homes and how we look at the visiting professional role into care homes, and that will be reported back to the next board meeting. And we've done lots of work to make sure that we're still promoting adult safeguarding issues throughout the pandemic and encouraging people that it is business as usual from a safeguarding perspective. So our own safeguarding team in Hartlepool have obviously still been working as usual throughout the pandemic, obviously having to do that slightly differently with Teams meetings and different approaches. But we have maintained, obviously, the entire safeguarding statutory function throughout the pandemic. And we will continue to look at how we need to work differently going forward. But I think that's a really valid point. And I think the other point we need to consider is obviously the fact that the pandemic will have impacted differently on different groups. So we are aware that we will potentially see more alerts that link to people with mental health issues. And I know there's a presentation later on the agenda today looking at the impact of the pandemic on mental health. So we'll consider to take all of those issues into account as we look at priorities for the coming months.
Thank you. Dominic Gardner.
Yeah, so I was just struck in terms of the report by the significant increase in numbers of referrals from NHS secondary care services. And I was just wondering, does that coincide with training updates? Does that uptake? Does that coincide with some form of campaign?
Yep, I think it's fair to say some of that's around reporting systems and how we've worked hard with partners over the last 12 months to improve the systems that capture that data. So I think some of it's around a recording issue, but also, as you say, around awareness raising campaigns within different organisations. So it's really positive, I think, that we're now capturing data from a range of organisations rather than predominantly the data previously was gathered through the local authority routes. So we now do get data from a much wider range of partners, including police, fire brigade, and, as you said, the acute trusts, and also more recently the ambulance trust as well. So we do now have a much more comprehensive picture, I think, of the safeguarding activity across the board.
Thank you. Is there anybody else? Okay, thank you. Then the recommendation as set out in the report at number 12 is that we note and endorse the annual report. Is everybody happy with that recommendation? Okay, thank you very much. Thank you, Jill. Thank you, Darren. Okay, item 4.2, mental health system development and response to COVID-19 pandemic. I believe that's Dominic Gardner.
It is, yes, but this is going to be kind of a three-person act in terms of the presentation. So what I'm going to do is myself and Neil from the local authority will be presenting the bulk of it, but Stephen's just agreed to introduce us, if that's okay. So could you start with Stephen? Councillor Thomas.
Yeah.
Thank you, Dominic. And I think one of the real significant areas of concern that has come out from COVID is the impact that it has had on mental health. And those impacts are not sort of restricted to or confined to one particular group or one particular area. There's lots of evidence that everyone from children and young people through to older people, through to adults living with a dementia, through to carers, through to working age adults, all of those people have been impacted in some way, shape or form by COVID. For some people, it's going to be through bereavement. For other people, it will be the pressures that they're facing financially. For other people, it's been things such as big changes to routine. And for an individual, for example, who is already living with a mental health condition, those changes can have real catastrophic impacts. So for thousands, if not millions of people up and down the country, there's been real significant impacts on mental health. And for a lot of people, there has been experience of a mental health condition or mental ill health for the first time. And I think one of the real sad things for me around that is that I think COVID's really highlighted that, yes, we've done an awful lot of good work around mental health. Yes, we have come a long way on addressing some of the stigmas attached to mental health. But I think certainly some of the evidence that's coming through from people experiencing mental health conditions for the first time, I think really does illustrate that some of those stigmas are still out there, given the time delays that we are seeing for some people actually coming forward to access support when they are experiencing mental health issues for the first time. But I think the report comes and the presentation comes at a very timely point. I think putting COVID to one side, I think it really is an opportune time to be looking at mental health service provision within our area, to be looking, I think, and building upon some of the excellent work, some of the real successes that we have, both within our statutory provision, but also within our third sector provision within Hartlepool. And I think as a town, we really are fortunate in some of those community and voluntary sector organisations that we have in the area, providing excellent mental health support and services. And I think it's a really opportune time to be thinking about what is working well, what things do we need to look at as areas of development going forward, and looking at our services in terms of our services being provided at the right time, our services being provided in the right place. And I think also importantly with mental health services, it's important to look at our services being provided in the right way, in a way that meets the needs of individuals in an open, accessible and empathetic way. I think all of those things are absolutely fundamental to providing excellent mental health services which are accessible to the people out there in communities who need them. And I think the report highlights, the presentation highlights some of the things that are happening, some of the challenges that we face, and some of the things that we need to be looking at going forward. And also, I think some of the changes that perhaps we need to make and some of the things we take on board from the very collaborative approach that I think has developed between organisations both before and during COVID. So with that, I will hand over to Dominic, who will take you through the presentation.
Thank you, Councillor Thomas. So again, just to start with, I think I'm having problems managing to share my PowerPoint presentation, so apologies for that. I don't know, has everybody got a copy of it in front of them? Because I think it was circulated last week.
Oh, I was going to say, sadly, it wasn't circulated, but it looks like we may have a copy of it to bring up for you.
Thank you. Yeah, so thank you. So just to reiterate, this presentation is a function of a large number of people's work within the Hartlepool area. So just in terms of purpose and what why are we doing this? So I suppose we're considering mental health both during and post-COVID, and the response of the system to the significant challenges that are going to be faced as a result of this. In terms of an area of focus, it's absolutely on place. So it's absolutely about Hartlepool. It's about the sub areas within Hartlepool as well. We need to get down to that level of granularity of detail. We're absolutely clear that whilst we focus on place, that means we're not interested in a focus on organisations, it's a focus on partnership and what we can all do together. And in terms of our responses, it's absolutely around something called the population intervention triangle. So if we move on to the next slide, thank you. So in terms of what I'm going to do, just want to set the challenging context. So what are the predictions for increased demand? Back to the population intervention triangle. So the importance of considering social determinants of mental health and what's called the civic response to this. So a focus on debt, poverty, and the other social determinants of mental ill health. A focus in terms of protecting our mental health and our emotional well-being. So what actions can be taken, what actions have been and continue to be, but also further actions can be taken at the community level. And then what the local service level response has been. So how have organisations come together to be able to start to come up with some of the responses to these issues, but importantly, what do we need to do in the future as well? So we'll describe something in terms of future plans, but also a very specific consideration of the role of the Health and Wellbeing Board in relation to this. So very clear about the ask. So I think everybody will probably have seen this slide before, but I'll just very quickly run through it again. So you can see a number of lines on the graph in terms of the first line being kind of a lilac line. This is where people find out I'm colourblind, obviously. The first line, I think, is a lilac line, and that describes the immediate mortality and morbidity that that was faced in relation to the initial surge in terms of the pandemic. You'll see the second line, which is the green line, which describes some of the impact of some of those, the health impact of some of those people, some of those people who've been unable to access some of the urgent care that they would have required during the initial stages of the pandemic. And then that third wave describes the additional impact again in relation to those people with chronic healthcare conditions who will have had their routine care services being impacted. And then the line that, we're interested in all of those lines, but the line that I want to focus on in this presentation is the red line, which you see starting quite early on in the pandemic and then increasing quite sharply and then staying at a very high level. And that's about the impact upon people's mental health and emotional well-being as a result of the pandemic. And absolutely, I think for people who are involved, people within this board, people within organisations, be the VCS, be the local authority or health, I think people will recognise that in terms of some of that really sustained high level of mental health need that is starting to be, that came through quite early on, but has been maintained during the course of the pandemic. So if we move on to the next slide, please. So in terms of the forecast, what is it that we're actually forecasting? So what we do know is that, like many areas within mental health services, what we saw was initial suppression of demand as people didn't come forward to receive care or treatment. What we do know is, so in terms of mental health services, they were absolutely open for business during that whole period of time. But I think people absorbed the message in terms of NHS focusing on COVID and thought that applied to mental health services as well. And I think also there's the understandable anxiety that there might have been at that time for people in terms of coming forward and having contact with people when most people kind of retreated into their own kind of social spheres. So what we're describing is we've seen that absolutely bounce back now. And in terms of our urgent care services, we're seeing demand way in excess of pre-COVID levels, probably around about the 10 to 20% mark in excess of what we were seeing pre-COVID. And we're expecting a further significant volume of additional needs presenting within communities and to systems over the next 5 years. So in terms of at a community level, over the next 5 years, the number of additional people who we expect to require some form of support from some part of the system are and these are frightening numbers, are the equivalent of 52% of children and young people, the equivalent of 23% of working age adults, and the equivalent of 22% of older adults. Now, that doesn't necessarily mean in the case of children and young people that it will be kind of half of children and people's population. It could be one person presenting 5 times over a period of time. But whichever way you look at it, it's a significant increase in terms of prevalence within the population. So if we move on to the next slide, please. And just in terms of some support for some of that, I suppose what I've put in here is just a slide that people may have already seen. So Young Minds carried out a survey amongst children and young people in Hartlepool between June and July. 80% of respondents stated that coronavirus made their mental health worse. 41% said it made their mental health much worse. 87% of respondents said they felt lonely or isolated. 11% of respondents said that their mental health had improved during the crisis, but that was often in relation to people feeling that actually absence from school initially was beneficial, either from the pressures of schoolwork or from the potential impact of some of their experience with peers in that environment. So we're talking about, we've got some very local evidence that suggests absolutely this is the case. And in terms of that model, it's been recognised that it's a model that was developed with the support of public health, with people from the CCGs and clinicians within TZESC and Wear Valleys. And it has been recognised at a national level as being a model that has validity. And what we're continuing to do is that will continue to be refined on a monthly basis. So if we could move on to the next slide, please. So in terms of the response, so I've already said it's place-based, but in terms of at a civic level, if we move on to the next slide, as I mentioned earlier on, we absolutely need to understand the importance of the social determinants of mental health. So by that, we mean the conditions in which people are born, in which they grow, live, work, and age. So we absolutely know that those types of factors have an enormous impact. So we know that there are clear gradients in terms of health outcomes for people, in terms of some of those factors, not only in terms of mental health, but also physical health. And we know that some of those inequalities that people experience will have become further entrenched as a result of COVID. So we know for absolute certainty that financial security is a key determinant of mental health. And we know that actually financial security will be one of the key things that's impacted as we move through some of the longer term economic impacts of COVID. So could you just move on to the next slide, please? And that's just a slide from the Health Foundation, which describes the impacts of poverty across the country and what that impact can have across the life course. So in terms of as a child, in terms of as an adult, and in terms of the way in which you develop behaviours in order to cope with your social circumstances. So move on to the next slide, please. So next slide is I'll hand over to Neil now, and he'll take us through some of the response that we've seen at the community level and in terms of services.
Thank you, Dominic, and good morning all. Yes, as Dominic's mentioned there, he's talked a little bit about civic level. I'm going to focus on community level over the next few slides and what the response is. So I'm just trying to figure out how I actually forward this as well, so bear with me. There you go. So response to a community in terms of actions protecting mental health and well-being. The 3 broad categories of factors which protect mental well-being. These are the individual control and community ownership, individual resilience and community assets, participation and inclusion, Mental well-being is fundamental to achieving a healthy, resilient and thriving population. The table below talks about the protective factors for mental health and well-being. Each of the below will have been impacted or changed as a result of COVID-19 and the response with regards to lockdown. So, for example, in terms of enhancing control, if you look at a community or an organisational level, you might look at things like self-help and the provision of things like advocacy, support groups, etc. Opportunities for expressing views, for example, things like tenant groups and public meetings, all will have had a major play and have had additional resources or services placed in high demand. In relation to things like increasing resilience and community assets, at a community and organisational level, there needs to be trust and safety. Social networks and relationships are really important. For example, contact with others through family groups, friendships, neighbours, shared interests and work, and indeed things like shared public spaces in relation to things like community centres, libraries, faith centres, cafes, parks, playgrounds will have all played its part. In terms of facilitate participation and inclusion, obviously it's been very difficult at these times. You can't get together in your groups. Some people will be feeling that loss at a local level, but from a community perspective, the things that are really important, particularly during these times, are things like activities that bring people together. They're connecting with others through groups, clubs, events and shared interests, and these are going to be more influential and important in the future. We also talk about things like accessible and acceptable services or goods, so things that are easily understood, affordable, user-friendly, non-stigmatizing and non-humiliating, and things like cohesive communities in terms of those that might offer mutual respect and bringing communities together. That's a little bit about the community aspects and the community level in terms of place. What we're absolutely focusing on next is the service level. So as those of you who may know, I play an active part in the local Hartlepool Mental Health Forum. These are just some of our partners who play a major role in supporting mental well-being across Hartlepool. So as well as TZESC and Wear Valley, who are an important partner in that and an important stakeholder, you'll see some of the other local organisations, including Mind, Starfish, Alice House, who are delivering things like Mindful Mondays and Feel Good Fridays. These are the kind of the well-being aspects that are keeping people going through this terrible time. And in terms of the Mental Health Forum, what we absolutely need is good local representation. Obviously, we are fortunate to have the Mental Health Forum chaired by Hartlepool, Healthwatch Hartlepool, who are very active in the community. Obviously, they've assisted with regards to a co-produced local mental health plan. We are there to represent the voices of people with lived experience and engage with services across the mental health system about the existing COVID issues. The challenges as we see it in terms of Hartlepool, as Dominic pointed out earlier, as lockdown eased, we've seen referrals increase to beyond previous levels with people presenting with greater needs. So ourselves as a local authority and the local network in terms of those community assets, we've seen frustration that a lot of local services networks closed during the pandemic. So those that weren't able to deliver because of national priorities have tried to offer information, advice and guidance as best they could. But obviously a lot of those services rely on face-to-face intervention. We've seen a significant increase in Mental Health Act assessments and admissions for assessment and treatment. We've seen an increase in people whose substance misuse has been compounded and has compounded their mental health needs. Remote assessments and working is often harder to assess people, as you'll understand. You don't get the opportunity to kind of see the environment that some people are living in and don't necessarily pick up on those non-verbal cues. We also have relied greater on technology, significant investment in across the system. For example, in GPs are using Attend Anywhere. We've seen Skype, Zoom and Teams, where we're able to get into people's homes where we probably wouldn't have done previously. We've also seen an increase in public protection notifications. These are the notifications that come through police and welfare checks through NIAS. So there's in the community has been more people reporting in through either the police or the ambulance service. And we're continuing to adapt to change to the ever-changing picture. Building on those successes locally, because it's very much in terms of our local community, we've seen the work of the community hubs, and they've been well presented at other boards as well as Health and Wellbeing Board in terms of the work they do to encourage and improve the broad wellbeing and community connections, and doing things such as the coordination and delivery of the National Food Distribution Services. They've helped with hot meals, they've kept people in touch with each other, they've provided information, advice and guidance to over 4,000 people. In regards to things like digital technology, there's been investment to ensure that our care homes are being able to keep people and families connected through applications, through social media and through news. I think it's fair to say that I think everybody probably tunes into the news at 5 o'clock to hear what the government are saying. Equally, the importance of staff wellbeing. We, as an authority and our stakeholders and partners, are obviously having to deal with things like death, poverty, abuse, isolation on a daily basis. It's been really interesting to see the public's response to that through things like Thank You, the NHS and key workers, Clap for Carers, etc. And indeed our own HR teams and services who are supporting our staff on a daily basis, who are dealing not only with this through their work, but also potentially in their personal lives. The police huddles have brought us a real greatness in terms of intelligence. So we at least 3 times a week we meet with the police in terms of a multi-agency response. So we've got health, care, housing and safety, looking at the community as a whole. We've increased our workforce in response to tackling the issues. So we've increased. We anticipated a 40% increase in work coming through the local authority social services department, and as a result of increased our workforce, we've seen a launch of the Tees and Weir Valley crisis service for Teesside with a single number should anybody require their services, and the development of a listening service in May 2020. Hartlepool carers have also been absolutely fantastic. They've responded very well to the pandemic and adapted their services to ensure that they remain in regular contact with their people who they support throughout the pandemic. And direct payments have meant that people who could retain their employee during the lockdown, even though they might not have been able to provide that direct face-to-face support, we've managed to keep them in contact with those people who know them well. And indeed, from a children and young people perspective, many more I could mention, I think, in relation to children's services, but primarily educational psychology team support to schools has been increased and supported. They've provided wellbeing support through schools to refer into Tees process. There's been a trailblazer across the Tees Valley, but more predominant in Hartlepool, with mental health support to teams for schools, and Future in Mind funding support for schools that are working across that trailblazer work, as well as provided essential support and services to children and young people. So I'm going to hand you back to Dominic, who's going to talk through the next steps. And I think you might be on mute, Dominic.
Schoolboy error, sorry. So in terms of from an adult and older person's perspective, I think what we'll be seeing in terms of next steps will absolutely fit in with the development of something called the Community Mental Health Framework, or the implementation of that framework. So as things stand, people may or may not be aware that we've begun a Right Care, Right Place programme pre-COVID, which was very much focused on local partnerships around wrapping services around local communities. There's now some national guidance around what the next stages of that should look like. So we're absolutely in the process of working through that with PCNs, with local authorities, in terms of thinking from a very local point of view, what will that look like? We're absolutely aware that funding will flow to support some of that. And I suppose what's key in relation to this is we absolutely recognise the need for the delivery of services and the input of voluntary and community sector agencies as well. So as well as utilise it, so Neil's already described the partnership that exists within Hartlepool. That will become a key vehicle in terms of developing and delivering this framework. And we're also looking to try and utilise what was previously the Crisis Care Concordat, which covers the whole of Tees, to rebadge that in terms of an overall mental health system driver, so we can also have some type of consensus about what can be done at scale versus what needs to be done very much at a local level. The other area that we'll be looking to take forward in advance of that is something called the Resilience Hub, and this applies for both young people as well. So at a regional level, there's funding available for the development of something called a Resilience Hub, which is about supporting wellbeing in relation to health and social care staff as we move through the COVID pandemic. And we'd already done some earlier work during the pandemic in terms of supporting local health services. What we also have available as a result of some monies made available through the CCG is the potential to expand that to a community resilience model. So we're absolutely looking and having conversations with the local authority in Hartlepool and the VCS in terms of what that might mean and what we might be able to put in place as a result of that. So if we just move to the next slide. Could you just move to the next slide here? Thank you. In terms of children and young people services, we've already mentioned the mental health support teams. They'll obviously continue to develop and embed in terms of the work that they provide for children and young people. They should be fully operational from January 2021. Information so far suggests that they are valued and ongoing, and you know that work will be of a positive benefit within schools. And there's just some information there in terms of the types of referrals that service is seeing. So that's 57% in terms of anxiety, 18% in terms of low mood and depression, and 22% in terms of what's classed as conduct or conduct disorder. In terms of that particular service, that is in addition to all of the existing specialist CAMHS services and other VCS elements. And I think it's important just to highlight that in terms of the investment in children and young people services and from a mental health and emotional wellbeing perspective, there's absolute clarity from the long-term plan within the NHS that needs to grow and needs to grow. So mental health generally investment needs to grow, and there's a standard in relation to that. And the children and young people's investment needs to grow faster than other areas of the mental health investment. So there will be money on the way to support those services. So if we move on to the next slide and then on to the next one, if that's okay. So I suppose that's kind of a whistle-stop tour in terms of the demand that we expect to see in terms of some of the really positive work that's taken place so far and what it is that we think needs to happen from here on in. But I suppose in terms of the Health and Wellbeing Board, I suppose what we would be seeking would be a commitment in terms of that mental health and emotional wellbeing impact are given the same level of priority as physical health, that we commit to support good mental health and wellbeing for all, especially communities that face the greatest adversity and barriers, that we absolutely acknowledge and understand that this is a long-term issue and it's predicted as a 5-year surge in demand. So it's not something that's going to come and go in a few weeks. And a commitment, I suppose, in terms of getting back to some of those conversations around kind of the civic and community level types of interventions, that there's a long-term approach to wellbeing-led planning approach, so that we actually look at all of the work that we do through a lens of wellbeing inequalities. And I suppose fundamentally that we recognise that we have to tackle this as a system issue, that because of the kind of multitude of factors that people face that leads to damage to people's emotional well-being or mental health, absolutely no single organisation has got the answers, so we all need to work in partnership. So I'll stop there and open up to any questions or discussion.
Great, thank you very much. I do have 1 or 2 points myself, but I wonder if anybody else would like to come in first. Councillor Harrison.
Yeah, thanks, Chair. A really good presentation, and you know, some of the points that are made I just think are great, that, and particularly the working together idea, because we can't work on our own and do the right sort of thing. So I think that's really good. You mentioned children along the way, and some of the things that were mentioned in the report, particularly around drug abuse, has obviously the knock-on effect for our young people. And a lot of families during this period have found it very difficult to continue. So the surge in looked after children, is quite significant. And I'm very glad to hear that there's money on the way to help with that area. Going back to the Hartlepool carers, and again, very glad to hear what a good job they're doing, as they usually do. I just wondered, Dominic, if you had any information on the young carers and how they've been impacted during this period of time, and if there is still the continued support for them. Thank you.
So in terms of whether there's continued support, absolutely. I suppose in terms of potential impacts, I haven't seen anything formal, but I think we can absolutely, it's not a leap to understand that this will have been an incredibly difficult period it's always a difficult time for young carers, but this will only have reinforced that, because I suppose some of the mechanisms that they would have had almost to have respite from some of those caring relationships were removed very early in the pandemic. And by definition, if the people that they're caring for are experiencing greater difficulties, that's going to bring a greater burden as well.
Yeah, thanks, Dominic.
I think Danielle Swainston wants to come in on that as well.
Yeah, just to pick up about the young carers, we are working with Hartlepool carers in terms of ensuring that our young carers are supported as they need to be. I think the biggest issue is identification, because actually there's a large proportion of organisations that actually aren't identifying these young people as young carers. So therefore, the support then isn't wrapped around those individuals because of that lack of identification. So we are doing some work with Hartlepool carers at the moment to try to almost like a communication strategy across the system to try and make sure that everybody who is got a contact with children, young people, are aware of the issues for young carers and able to identify them so that the support can be put in place. So there is work ongoing.
Thanks, Danielle. Nice to see you.
Are there any other questions from members? Okay, I noticed through there, it's not, I don't think it's particularly well known, but myself, a number of years ago, I struggled for quite a few years quite badly with depression and anxiety. And I must admit, the only thing that managed to break the cycle for me was not through any kind of medication or anything else. It was the recommendation of taking up exercise again. And what I did, I signed myself up to do the Great North Run, and then I kind of had to get out and start practicing. And for me, that was a perfect way of breaking that downward spiral, and it was the beginning of kind of getting back to some form of normality. And I just wondered, listening to that, and I know we engaged with new social prescribing services in Hartlepool just prior to the pandemic, and I wondered how those type of services may play a part in what you, because I noticed throughout there they weren't referenced, and I get there's a lot of collaborative approaches going on, but do you see a role for social prescribing and other services like that in this type of work?
So absolutely do, and I apologise. There'll be a huge range of things that we weren't able to include in the presentation in the context of just trying to keep the number of slides down. But we know that social determinants impact upon people's emotional well-being and their mental health. So it stands to reason that actually social interventions will have an impact for those individuals in terms of improving their well-being and health. I say Fiona's got a hand up, and I think Fiona is very close to social prescribing. So I wonder if she wants to come in.
Yeah, Fiona.
Thank you. I think I'm just jumping the queue ahead of Stephen there, so apologies. Social prescribing, definitely, and we're growing the team in Hartlepool, and they are really closely working with the Hartley Power guys and with lots of other local organisations, including Hartlepool Carers. The thing I wanted to mention in particular in relation to exercise is the primary care networks going forward will have the chance to recruit a health and wellbeing coach, who I think will be able to specialise more in that sort of health and fitness, and some of them might also choose to work with dietitians as well. So I think that's an area that's actually expanding. So the social prescribers might be the funnel or the gateway, but they'll be able to pass on to more specialist people depending on the person's need. And I know, Dominic, there's a small pilot going on, isn't there, with the primary care networks around access to mental health support, sort of directly via the practice?
Yeah, so there's a pilot where we've got one worker in the north of the patch, one worker in the south of the patch, who are actually just embedded in the practice, and almost operating a type of GP clinic type approach for people who can. I think it's probably open access. So there's that pilot. And then I also know that in terms of one of the practices might not be in Hartlepool actually, but they're looking at a kind of population health model as well. So very much thinking about the types of workers that they would want within the practice to match the local population.
That's great, thank you. Councillor Thomas. Still muted.
Sorry about that. I keep taking my hand down and forgetting to unmute myself. I think the area that you highlight there, Chair, is absolutely fundamental to everything that we are talking about here today. And I think one of the big points for me, one of the big areas that's come out for me from COVID I think it's highlighted the extent of the number of people that we have within Hartlepool who previously weren't known to services, but who were in their day-to-day lives experiencing quite significant levels of loneliness, of isolation, of anxiety, of some level of depression. And I think that one of the things that the social prescribers, which our community and voluntary sector organisations, which some of our local authority services and other services can do, is if they can engage with and become active with that group of people at the earliest possible opportunity, then I think it does help, firstly, to just simply give that group of people a richer and more fulfilling day-to-day life. But I think on the other side, with regard to service provision, what it does is hopefully give those people that support at the earliest opportunity, which then stops them going into some of those higher levels of support provision, which becomes far more distressing for the individual and their family, far more expensive for service providers. But the fundamental thing is people getting support at that earliest possible opportunity. So I think one of the things that I'm really pleased about from the council is that we are starting to do a lot of work around getting that message out around get support, get help, speak to your friends, speak to your family, speak to community and voluntary sector organisations. Please don't continue living lonely, isolated, feeling anxious on your own. There are people there who will help. And the earliest that people access those services, the earliest opportunity that people take to access support is, as I've said, better for them, better for their families, and better for service providers.
Absolutely, Councillor Thomas, thank you. Councillor Ward.
Hello there. Hiya. The presentation was absolutely fantastic. I absolutely loved reading through that and listening to what you were saying. As someone that works within the community at the root level, and is seeing this hands-on on the effect it has, especially around anxiety. You know, it's been hard, and so to say this is a breath of fresh air, that especially where we're going to think of bringing more people together from the root and helping these people and reaching out. The biggest thing that I've seen is obviously it's been around the anxiety. And the problem that we have got, and I think by working together in what you were saying, is a lot of people now that have been within the homes for a period of time, their pathways now are stuck at home, and the anxiety is to over the point where they're scared of getting out or making that step forward. So with the community groups coming together, because not everybody's going to fit in the same box of, you know, of what fits one person might not fit the other, and that's what I've seen. And through this, we've worked with anxiety and helping those with the tools and techniques to help themselves. And I've seen a transformation of helping around this. So I think the more people come together, the more the help that, the more we can make a difference in our community. So thank you very much. I really enjoyed that.
Great. Okay, thank you. There's nobody else to speak. So again, just thank you all very much for that really detailed presentation. There is no recommendations. I think it's just to accept the recommendation. So thank you very much. We'll move on to item 4.3, and that's Joe Heaney for the needs-led neurodevelopmental pathway for children and young people.
Good morning, Chair. Just to note that Dominic may want to jump in as well as Danielle at some point or at the end. But the aim of this report is to basically just give the board an update as to where we are in relation to the neurodevelopmental pathway. So just a bit of brief history for members who may not have been aware of the work that was undertaken or why it was undertaken. It was identified a year or so ago that the pathway for autism diagnostic, the autism diagnostic process for children was quite difficult and challenging for families. This was identified through consultation that we undertook with the Parent Care Forum, as well as obviously wider families. And there was also a long wait for the diagnostic aspect of the process. So we worked together, both ourselves, obviously, the CCG, Tees Esquire Valley, local authority and parent carers, and with families to look to see what we needed to do to improve that process. What we identified was that we needed to work better across education, health and social care in order to make that system work more cohesively. We looked to see how we would best approach this, and we identified that actually we needed to make this pathway more needs-led as opposed to diagnostic-led. What we were identifying is that families, regardless of the outcome of any diagnostic process, the children's needs remained the same, either prior to, during and or after a diagnosis, whether it was or wasn't given. So we wanted to develop a service or a system that recognised that and to try and support and help families. So just in terms of action that was undertaken, and I must stress that this work has all been done collaboratively. There's not one organisation that hasn't been involved in some shape or form in order to make this work. It needed to be. Obviously, it's identified in the previous presentation. We need a system response, and we absolutely needed a system response in relation to this piece of work because of the way children and families move across the different organisations and the different sectors. So one of the things we set about and firstly developed was a family support service that's been delivered by Daisy Chain, and that was to make sure that, as I've highlighted, that families were supported prior, during and after the diagnosis process, so that they could, where appropriate, offer training and support directly to families and children, young people, but also to support families in accessing the most appropriate support for whatever the presenting need may be of that child or young person or the family at a given time. So that's a service that is still in place now. And has been reviewed, and we are in the process of looking at how we extend that to a more permanent offer. We've also had in place a service called the Sunflower Service. We heard a lot through the consultation from families around challenges with supporting around sensory needs. So we worked with North Tees and Hartlepool to get them upskilled in a programme that we identified or we learnt about from St Helens. That is something that is now available to families within Hartlepool. whereby they can access 3 workshops to support within the family home on issues around that may present as a result of sensory needs. That is a service that we're about to review to ensure that we are meeting the needs as we think we are with the families, and the parent carer service. Are really keen to be more involved in that piece of work so that they can offer some peer support, as well as obviously the professional support that's currently provided. We've also worked to provide a specific service, or a specific service for autism. So historically, anybody that was referred onto the diagnostic process would go first through the core CAM service, which was impacting on the length of wait that people were having to wait to get onto the specialist element to determine whether there was a diagnosis or not. We've invested within Tees Escombe Wear Valley so that we've created a specific service that will accept the referrals for children age 5 and over, rather than them going through the core CAM service, as I've just highlighted. We've also put within there a triage, which is made up of multidisciplinary triage. As I've identified, children work across the system, so it was important that we had a multidisciplinary triage system so that families could be, that their needs could be reviewed immediately and the most appropriate level of support identified and delivered. If it was deemed that children most definitely needed to go on that diagnostic process, then they go on that diagnostic process quickly. This is around being able to make sure that all needs are being identified and addressed appropriately at the earliest opportunity. The other points I would just like to highlight, obviously it's already been mentioned around the pandemic and the impact that has had. It also has had an impact in terms of autism assessments, because some of the assessments that need to be carried out to determine whether there is a diagnosis or not need to be done in different settings. So obviously that has had some impact on the times that families have had to wait. Not too much, and I'll come to that in a moment. But it has had some impact. But since September, those assessments are starting to now get back to normal, and where schools are happy. Obviously, the teams are now able to go back into the school setting to do those observations. The final point, I guess, that I would just like to highlight before I come to sort of where we are currently around weights, etc., is that as I've already said, we're in the process of doing an assessment in terms of the sunflower service to make sure that it is meeting needs. We're also we will also look at reviewing the new pathway within 6 months. So that currently, it went live in September, but we will continue to review that pathway to make sure that it's still working as we would want it to. Obviously, as you would appreciate, we haven't seen the numbers of referrals through the triage process as we would have liked. So there's been communications out to schools just to highlight that the service is now receiving referrals because they are able to go into settings, which brings me to sort of the current numbers, if you like, for Hartlepool. So in terms of where we were for December, if we've got 79 children waiting to have the diagnostic assessment, the process to be undertaken. So if a family was to be referred now, they would start that process within 6 months, with the aim of them having their MAT, which is where the multi-agency professionals come together to determine whether there is a diagnosis or not within 9 months. And that is where we wanted to be. That was the aim of where we wanted to be. So when some members will remember the work that we started many years ago to try and address the waiting times, etc. But I think that's really good news for Hartlepool, that's where we want it to be, and that's where we are. The other thing to highlight is that we've had 44 families that have gone through the new triage process from Hartlepool. 25 of those were referred from schools, and the others were referred from the CAMS service. But as I said, we have communicated out to schools just to advise that, you know, we're back up and running, and services can come into schools, and we'll continue to do that to make sure that we're getting we continue to see a rise in children coming through that multi-agency triage approach, because it is where families will be assessed to determine what support is available and what may best meet their needs at the earliest possible point. So I'll leave that there. If there's any questions, obviously happy to take that, or if there's anything that Dominic or Danielle wanted to add at this point.
Just before I bring Councillor Ward in, I'll just, if Dominic or Danielle wanted to add anything further. Danielle.
Thanks, Chair. Thanks, Joe. We've just to back up what Joe's been saying, we're fully involved in this process. There has obviously been delay in terms of referrals to the pathway because of the pandemic and the assessments not being undertaken. From September, we've circulated another communication to schools to make sure that schools are fully aware of the process, because there was still some concerns about thinking that the assessments had stopped and paused. So we have followed that up with schools. We are involved, so the local authority is involved in those triage discussions, and we've internally had a recent meeting just to review how that's going and fed that into the process. So I suppose the one thing is it's early days. We're sort of finding our way through this pathway, but we're just keeping it on review constantly as we're going along to make sure that we are getting it right for families. We have had conversations as well with our Parent Carer Forum, and their feedback from parents has been fed into the system. So their voice is being heard within that process as well.
Great, thank you, Danielle. Dominic?
So suppose, again, as Danielle and Joe have said, it is early stages. I mean, it's encouraging in terms of the current weights, but obviously we need to see what the real pattern of referrals and flow through to MATs and then subsequent waiting time is when we get more to a kind of a realistic steady state, I suppose. Just to reflect, though, I think actually removing the pathway from core CAMS has been a really important step. In terms of clarity of numbers, so in terms of clarity of numbers, but also in terms of actually just streamlining that, and in terms of reducing the timeline that people are kind of waiting before they even get to the stage before we understand whether a MAT is required or not. So I think that's been a really positive step, and fingers crossed it continues to go in the right direction.
Great, thank you. Councillor Ward.
Hello, thank you. It's very welcome hearing about the pathway and, you know, and how the services are to improve. My daughter is actually on the autistic pathway at the moment, and it's like things just went, you know, so quiet for so long. It's only getting picked up again now. So it's lovely that's happening. And one of the things I do want to ask is, and I know it's early days and information's come together, is when children are referred on the new pathway and they do not present as what you would be on the autistic spectrum, although do present with difficulties and they have ADHD. Now, I know you've said there's workshops available for sensory processing disorders and the like. What provisions is going to be on that pathway for children with ADHD? Because ADHD is one of those things that I feel slip through a net a lot, and you end up with adults with ADHD that slip through a net as well. So what is early intervention that you've got in plan there to bring that together for coexisting conditions?
Yeah, absolutely. And I think, you know, members may remember that when we started on this journey, we wanted it to be all neurodevelopmental conditions. Within the paper, we have highlighted that there's work currently underway with TÜV to bring the ADHD ADHD diagnostic pathway into this system as well. So that what that will do is, it will reduce duplication for families going down one pathway and potentially having to go down another. It's just the work is underway within CHUV to basically identify what that will look like in terms of what sort of team would need or staffing would need to be able to support that so that it was seamless. What I would say though is if a child or young person is presenting with any kind of neurodevelopmental need, then the support, nobody would be turned away and not be offered access to support, because that was the real ethos behind what we tried to do from the offset. Because there is obviously there's a multitude of presentations that could present that may have very similar symptoms, if you like. So the bubble of support that's outlined within the paper and that the wraparound support is there to support people with a need, not the diagnosis. But the aim is that we get to a place whereby the diagnostic part for ADHD also becomes a part of that pathway. I don't know whether Dominic would want to add anything further to that from a CHUV perspective, but that's certainly there is work underway to do that.
Okay, thank you.
Dominic has his hand up.
Yeah, it's just to in terms of what Joe said, absolutely. So the plan is that the ADHD pathway from a diagnostic element would also shift across, so you've got that more formal neurodevelopmental pathway. I suppose the only other thing I would add is that the service are currently looking at some new, I suppose there've been developments and innovations in terms of technology to support diagnosis as well. So they're just in the process of looking at purchasing some of that technology, which hopefully would help in terms of pace of that pathway as well. But I think going back to Joe's point, it's one thing to have the diagnosis, and we know that opens doors in terms of and provides a degree of clarity for families, etc. But people still have needs that are wrapped around that, don't they? And it's really important that we get that bit of it right for people as well. And I think that's what the SD pathway is really starting to show.
Great, thank you, Dominic. Councillor Thomas.
Thank you, Chair. Finally got it right. And I think following on from Councillor Ward's question there, I think one of the areas that I would like to hear a little bit more about is during the pandemic. Clearly, the sorts of conditions that we're talking about are going to be significantly impacted upon by some of the fear, the changing routines, the pressures that have come onto families during the last 5 months. And has the service been able to be flexible and to offer additional support and to meet those additional needs that have come out for families during the pandemic? And I think my second point sort of links back into what Dominic's just said there. And I think the pathway, I really do feel, represents a real step forward in the way in which partnerships are going to work, the way in which services are going to be provided in future. But I think one thing that's important going with that is that there is the sort of ongoing flexibility around the way in which services are going to be developed, the way in which services are going to be commissioned, in order to accommodate some of the learning and some of the areas in which we identify as change being needed in going forward. So it just really is that flexibility going to be there going forward.
So in relation to your first point, we ensured that the family support service, they had to adapt like many other services. So they have done a lot more telephone support. And obviously that's something that we obviously learning about and thinking about in future services, how we incorporate that as sort of a main feature. So yes, in terms of the family support service, yes, they absolutely did adapt and look to offer that support, but as we all have, obviously video, Teams, etc. And thinking about how we commission services and how we develop services, I would hope you're seeing, and will continue to see, certainly from a children young person's perspective, we work very closely now with parent carer forums, and just in relation to the services that I've outlined this morning, They are a key partner in doing the review of those services to make sure that we are getting it right and that we are meeting need, and that they do, as Danielle said, have the opportunity to feed into that process so that we can be more responsive with existing services, but equally for any future commissioning. We are working together on commissioning services jointly, and we look for opportunities wherever we can to do that. There are a number of service areas that we're currently, I guess, that are in tray for us to take forward around that. There are lots of opportunities when it comes to children and young people services because of the way children move across pathways. So absolutely that there has been a commitment from the CCG and as well as the local authorities to look to always jointly commission where we can, because it's better for children, young people and families.
Councillor Buchan.
In the past, members of the public who have attended the Health and Wellbeing Board have expressed the concerns with the time it took to get help with autism. I'm sure they'll be very pleased to hear about this new approach.
Thank you.
Thank you, Councillor Buchan. Councillor Harrison.
Thanks, Chair. Yes, I would echo that. I think it's really good news. However, you mentioned, Joe, that the period of time, 6 to 9 months. Now, I'm sure that's a lot quicker. That I think that was for assessment. Am I right? Yeah.
So the 6 to 9 months, Brenda.
Yeah.
Sorry, I probably didn't articulate that very well. So in terms of, obviously, once children start the assessment process, it takes 3 months. So if a child was to come onto the to be referred now or needing to go on that pathway, their assessment would start at 6 months and be completed by 9 months.
Right. So that still seems a bit of a long time. Have you got an aim? And I'm sure it's a lot shorter than it was prior to this. So it's really good news that it's quickened up. But have you got an aim to actually reduce that 6 months?
9 months.
I appreciate it takes 3 months to do the assessment overall, but can they get there any quicker?
So in terms of where we wanted to be, Brenda, we said we wanted people to have gone through the process and have a diagnosis or not by 9 months. So we are hitting that. That's not to say that there was lots of work done and continues, and there's lots of different schools of thought around what is an appropriate length of time, because what we don't want to do is give somebody a diagnosis that they have for the rest of their lives, potentially, that might not be accurate, and that's certainly true for younger children. So 9 months is where we aim to get. That's not to say that, obviously, as a team of practitioners, people want children, young people to come through that process as quickly as is appropriate. But in terms of where we wanted to get to, that is 9 months. That's not to say that we're sitting back on our laurels, because we absolutely aren't. But there is still a lot of scrutiny around this pathway. As we've already said, it is still very new. So that ongoing review, assessment, involvement of Parent Carer Forum to look at that multi-agency approach to look at, is this working, will continue. And the aim is that we want the time that families wait to be as short as is appropriate. But like I say, in terms of where we are, it is where we wanted to get to.
It's just from the perspective of a young person, 9 months is a long time, and it's a long time within their family and within their school. So I appreciate everything you're saying, and I think the work that's been done is fantastic, and I really commend the new approach and the getting rid of tiers in order to get straight onto it. But I also appreciate that perhaps in the future, and for some children, that 9 months could be reduced.
Can I just, sorry, Brenda, I appreciate what you said, but in terms of where we are now is that those families and those children and young people aren't left with nothing. So they are assessed, in terms of if there is a need.
You're not just leaving them for 6 months.
Absolutely not.
Right, okay.
That is the formal diagnostic part of the process. So that presentation and that initial referral, from that point that is assessed and triaged, there is support offered from that very first point.
That's
so
great.
Absolutely. So yeah, people aren't waiting 9 months. People are offered support based on.
I'd misunderstood, I think, what you'd said. Yeah.
Oh, no,
okay.
It may have been me not articulating it clearly, but yeah, in terms of the completion of the diagnostic is 9 months. Support is offered from the get-go. Absolutely.
Thank you very much, Joe. Thanks.
Okay.
That's great. Thanks, Sue. In fact, in answering both Councillor Ward's points and Councillor Harris, and you picked up on two of the bits that I was going to ask anyway, but it was really, really important that for me that you clarified that point there, because if there was that 6 month wait before any engagement, 6 months for a family that are struggling is a long time, and so it's really good to hear that those families will get the help that they need to. Well, like we said many times, Joe, the diagnosis for many people, that isn't the end goal, and it isn't the important thing. It's the help in managing the situation, and if we're able to do that in the 6 months prior to the diagnosis process starting, then that's fantastic. And similarly, you picked up on the point, excuse me, from 3.8, where it says that it's currently open for ASD referrals, but that ADHD is hoped to come along later. Again, you clarified in there that actually that support is still there for parents who have children that may require some assistance with traits for ADHD or anything else, because I do know from speaking to other parents that there is sometimes everything seems to be focused around ASD. And for parents whose children have other issues, there is sometimes a feeling that their issues are secondary and that they'll have to hang on fire. So it's really good to hear that those services are still open there and that people can come forward, and it's we do need to get that message out as well.
It was a key aim that we absolutely recognise that, and as I've already said, families' needs or children, young people's needs don't go away with the diagnosis, and you know that we needed to make sure that the support. We knew what the support was, we knew how to access that support, and where there were gaps in support, we were able to try and fill that with the family support service and the Sunflower service, so that we could, as we've said, once children were being identified with a need, we could signpost to the relevant agencies or organisations.
Great, thank you. Councillor Ward.
Yeah, I think I just want to highlight again, I think I just feel the need just to say, I mean, this is very welcoming as well. And obviously over the years I've worked with a lot of clients and a lot of parents whose children weren't diagnosed but do present with specific difficulties. And, you know, how hard that is on the families, how it's hard on the children. And it is being highlighted so many times. I mean, and I help people through the anxiety and the depression and what this brings to these families. So just on behalf of, you know, all those families that, you know, I have helped with the parents, you know, that this is welcoming, that if there isn't a diagnosis, if there isn't that, you know, where they think a diagnosis is going to open the doors to help, that there is light and there is help for these parents who have children with specific difficulties but do not quite tick the boxes that need to be ticked for a diagnosis. So to me, I welcome that, you know, and I'm looking forward to seeing this come forward and seeing that support for those families. Thank you.
Great, thank you. And thank you very much, Joe and Dominic, for the support as well. Okay, thank you. Next item then, 4.4, COVID update presentation from the Director of Public Health.
Chair, Joan, have you got the presentation there? Great, thank you. Yeah, so this is just the latest update we have for the current COVID situation. If we can move on to the first slide, please. Okay, so the general overall rate is increasing still. We're around about 4,405 per 100,000 across the course of the whole pandemic. And obviously, as you can see from that slide, again, we continue to remain with our rates higher than the England rates. Next slide, please. Looking at the number of cases, you can see we follow the same pattern, although we see an increase in the rate for Hartlepool. What's interesting about that is we are starting to see a reduction in the number of cases coming through now since lockdown. Can we go back to the previous slide? Thanks. Since lockdown was started, I think you can see there at the right-hand side of the bottom graph there, you can see a spike, which was our highest spike of cases, around about 568, which we believe was a result of people sort of, going out before lockdown was in place, plus a combination of half-term week and Halloween and a multitude of factors there. But it's been coming down steadily since then, and still with the provisional data we've got at the moment, which isn't included on there because it hasn't been ratified yet, still seems to suggest that the rate is coming down. What I would say at the moment, though, is we're probably around about 241 cases per 100,000. And I think if we go on to the next slide, please. Looking at the 7-day and 14-day averages, you can see that illustrated a little bit clearer there. So I think our latest 7-day rate, as I say, is about 241 per 100,000 and declining. That's still too high. We are still one of the higher areas in the country with that. It's good news that it's coming down, but I am concerned that obviously as we're coming into coming out of the stricter lockdowns, down measures and into the tier 3, which whilst being strict have some subtle alterations to them, and as we head towards Christmas and the potential for activities around Christmas, I think we do need to get our 7-day rate down even further, and I think it's starting to indicate that that it's starting to come around closer to the 200, but 200 per 100,000 is still very high, and it's still very high for us as well. Our testing is coming down as well, and our positivity rate is declining as well. That's around about 8.5. It has been up around 15%. So that is a positive situation as well. But I think there is just a little concern there around the fact that our testing rates are coming down. And I think we need to keep encouraging people to get tested if they think they have symptoms. I think one of the issues we have is that we're starting to see people come with a variety of different symptoms, and so we need to be doing some more comms around those and encouraging people to get tested should they have other symptoms as well. Okay, can we have the next slides, please? Death rate still remains relatively higher than the England death rate as well, at 146 per 100,000 across the course of the pandemic, although it has reduced slightly as well, and we're not seeing the levels that we have seen previously as well. And the next slide, please. So in terms of where we're seeing the cases, again, it continues to remain, as you would expect, in those areas where we've got higher population density and that side of things. We have had some work looking at the various different aspects of the population that's come through from PHE, and we're starting to get that now on a more regular basis, and I think it has shown some interesting figures around where some of the cases are actually concentrated in terms of levels of deprivation and things like that. And I think it certainly matches the thinking that some of our more deprived areas are seeing some more of the cases and higher numbers of the cases. And I think this is going to guide us in terms of where we focus some of the work in the coming weeks around our testing and raising awareness of the importance of testing and symptoms. So if you look at the next slide, I think if we have a look at that, please, that shows you where the density of tests are. And we can see actually in some of those areas that have got quite high numbers of cases, we're not getting high numbers of people coming forward to be tested. And I think that's important, that potentially means we may be missing people with some of the cases there. So again, I think that's important to really guide where we go in the next few weeks to look at testing and look at understanding really where we are with the population. So I think overall, in terms of the situation, there is some positive news there in that the cases are coming down, but I think we can't be complacent. We can't take our eye off the ball with this. We need to make sure that as we go forward, we keep that messaging out there. We keep encouraging people to maintain their social distancing, their good hand hygiene, appropriate use of face masks, and all of those messages that we're going to keep pushing as well. I think we've got a concerning situation coming up with Christmas. I think we need to be making sure that we've got the messaging clear for people out there. I think we've got obviously the good news about the vaccines coming online this week, but I think again we still need to make sure that we put the messages out there that people can't sort of relax the precautions at all. It's really vitally important that we maintain those measures because we are at that high rate. We do need to get the numbers down quite significantly still, and I think it'll be a while before all of the protection from the vaccine becomes across the population. So we're going to be having to do these precautionary measures for a long time yet. So I think those are my key messages to take away today. There is some positive news there, but I think we just can't take our eye off the ball and relax any of the strict measures we've got in place at the moment. I think it's really important that we keep those messages coming.
Yeah, absolutely right, Craig, and thank you. I took a look back the other day once the tracker came through from Dean. I took a look back through the historical trackers over the past weeks and months, and what I was pleased to see is that, yes, you're absolutely right, we can't take our eye off the ball. We do need to keep getting that message out there, and we do need to encourage people to stay vigilant and not let their guard down. But I was slightly pleased, and I know you tell me all the time, don't focus too much on the numbers. They could change, and they often do. But I was pleased to see that our 7-day rate had fallen below that of the week following we went into formal restrictions at the start of October. So it was really reassuring to see that something was working and that we were heading in the right direction. And so for me, I think it was, and the reason I mentioned that, Craig and members here today, is because I think often there's a lot of doom and gloom when we say that numbers are still high, and admittedly numbers are still high. However, I think it is important to recognise that when things are going in the right direction and people's efforts are having the desired effect, that we recognise that as well. So thank you. I've got Councillor Buchan.
Hello, Craig. Do you know as yet how the vaccine will be rolled out across Hartlepool?
I don't. We are obviously having conversations with the NHS who are actually rolling that out, and I'm just wondering actually whether Fiona is probably better placed to outline that, as they're leading on the rollout across certainly primary care.
Thank you.
Would you like me just to chip in for a minute? I'm going to chip in and actually probably reference Karen, who I think is still on the call from the CCG. We're working with the primary care networks to help them to varying degrees. Some of the vaccines will arrive in the next week or so, with the rest following the week after. But I think Karen probably has a bit more detailed information than me at this point. If she's still there.
Yes, I'm still here, Fiona. Yeah, so the COVID-19 vaccination is being rolled out under an enhanced service through NHS England. So it's not an area that the CCG is actually delegated for. It's an NHS England enhanced service. Practices, so we've got 11 practices in Hartlepool, and they have until midnight, well, 23:59 tonight to sign up to deliver the enhanced service. The discussions we've been having with practices to date have been really positive in the practices wishing to undertake the enhanced service, but obviously officially they have until that time to sign up to it. There is an expectation that there will be a wave one of an area being put forward to go first. And one of those areas is within Hartlepool. We're awaiting confirmation from NHS England in relation to which primary care network that would be. And then subsequently, as Fiona has outlined, it would roll out very quickly across the rest of the town and then the rest of our ICP area. The people who would be called forward first would be in line with the guidance that's been offered from the Joint Committee for Vaccination and Immunisation. So there's very clear guidelines with the over 80s being the first group within that population set. So we'll be working with NHS England to make sure that it's rolled out appropriately in line with those guidelines. But it's really good news for the area in terms of the positivity within general practice to make sure it happens.
Thank you, Karen. Councillor Richardson.
Yeah, just first of all, I need to declare an interest that my mother is in an aged person's home. But my question is of a general nature. We were just discussing earlier on about mental health. There's quite a number of people in this town who's got mothers or fathers in homes, but we can't see those people. And one of the issues is that you need to have a test. As the government says, the government has sort of indicated that this is possible now, but it isn't possible unless you have a test. And they're talking about a half-an-hour test, a test that will be done in half an hour. How is that going to happen in homes that we have at the moment? Because quite a number of homes would like that, but they haven't got the facilities at the moment.
Yeah, that'll be the lateral flow tests that are being rolled out at the moment, and I think they're being rolled out incrementally across care homes. I think, from my understanding, that I think 3 care homes in Hartlepool were in the first wave of homes that were issued with the tests. They were starting with the larger homes, and I think Jill or Danielle might keep me right on this as well in terms of that. But I think it's going, I'm not sure of the timescales, but I can find out for the rest of the homes. I know it's obviously going to cause some extra work for the homes, and I think they need to be set up to do that. I think training is also provided with the homes to carry that out as part of the national government scheme that's being implemented at the moment. I believe it's due to be rolled out in the next couple of weeks, so all homes eventually will get access to the lateral flow test, but it is something we are keeping an eye on, because clearly, as you rightly say, it is linked to the visiting policy. I think also it's linked to particularly the tiers we're in as well, and also any ongoing outbreak control activity that might be happening within those homes as well. So it does sound a little complicated, but there are sort of processes in place to ensure the safety of residents there.
Do you want me to come in, Craig? Just quickly, we are working with each of the homes. So the commissioning team is working with each of the homes to undertake a risk assessment for each home to ensure that they've got that assessment of risk and that the testing can be undertaken appropriately. Within the space that they obviously need to find space to be able to undertake the test. They need to have a space to wait for the test result and then obviously undertake the visit if the test is negative. However, as Craig identified, the guidance specifies quite clearly that a care home that's got a current outbreak cannot have any family or friend visiting. And we have got a large proportion because of the cases in our care homes, mainly staff related, but because there are outbreaks in those homes, they then can't undertake any visiting at this stage. That doesn't stop them preparing. So even the ones that are currently in outbreaks, our link officers are working with the homes to undertake a risk assessment so that as soon as they are out of their outbreaks, they can manage that. We do know it's different for each home. So some homes have got more space than others, but the link officers are working with each of the homes to make sure that they can implement as quickly as possible once we've got those homes out of the outbreaks. The ones who aren't in outbreaks, the Department for Health and Social Care are doing the link with the care home, and the tests will be delivered to them within the next couple of weeks.
So can I just ask, those homes where there is no outbreak of the virus, is there a guarantee that people will be able to see their loved ones before Christmas? Because some people have not seen their loved ones since March.
At this moment in time, the exact timescales are unknown, Carl, because the tests are being delivered directly. They're not through us; they're directly from the department. So they're doing the we've had an indication that the first set for the 3 largest care homes have been delivered, but the rest we haven't had notification yet when they will be delivered. On the calls that we've had with DHSC, they've said that it will be before Christmas. It will be within the next week or so, but we don't know exact for each care home at this point.
Thank you. Councillor Thomas.
Thank you, Chair. And Craig, going back to one of the points from your presentation where you mentioned different symptoms, we had a presentation on Friday at our Health Watch coffee morning from one of the care home managers, and they mentioned that in the first lockdown phase, in the early days of COVID, they'd had quite a number of staff and residents who had contracted COVID, and said that none of them had actually shown initially the symptoms that are regularly described in the media releases that we see as being the key ones. So I think that message about there being different symptoms that people can present with is a very important one. I think the second thing that I just wanted to ask about was long COVID, and this may be yourself or Fiona or one of your other health-related colleagues, and how many cases of long COVID are we seeing coming through in Hartlepool? And I saw in one of the government press releases that there are going to be certain centres identified up and down the country regionally, and what would be the closest long COVID support centre for anyone who does contract that living in Hartlepool?
Nicola's going to come in on that. Oh, I've got Nicola's hand up. No, Fiona?
Sorry, Chair, can I just add one other thing?
Yeah.
I think another thing which linked into COVID, which is really important, is the uptake of the flu vaccine, and just any sort of information that you have, Craig, on how well that's going in Hartlepool.
Would you like me to chip
Fiona,
in with
yes,
the...
Fiona, if you could come in first, please.
Yeah. So long COVID, it's very difficult to say how many cases, but suffice to say that practices are reporting a lot of activity from people who are perhaps were in hospital in the first wave, or perhaps were fine at home, but are reporting with a whole range of really unusual symptoms, not necessarily all the same. So I would say that they are busy. There is a service currently being worked up in North Tees. So I've just got the details this morning, actually. I haven't had a chance to read them yet, but it looks really good. It looks like practices will be able to refer people through the single point of access that operates in Hartlepool that you might be familiar with. And then they'll go into a team approach to work out, do they need a physio? Do they need another consultant assessment? All sorts of other things. Do they need a social prescriber, as we referenced earlier, for some social support? So I thought it looked really impressive, and I think the intention is for that to be up and running within a week to 2 weeks. It's just a question of, I think, dotting the final I's and T's.
Sorry. Craig?
Yes, sorry, just looking at the questions there that you just asked. So yes, symptoms in terms of the key messaging, I think we'll go going back to that one. It is something we've been flagging up now, because you'll probably be aware that I think I've mentioned before, one of the things we do when we have cases and outbreaks, we follow backwards to see where people have tried to find out where people have acquired it from. But when we do that, we talk to them about their symptoms and that sort of thing. And what we are sort of finding is that more people now seem to be coming forward without having the standard 3 symptoms as well. So whilst it's obviously we are still highlighting those and saying it's important, we do need to do some more work around those other symptoms as well. And I think it's interesting how we are starting now to see more people coming through like that. And I'm not sure whether that's what that might be being caused by, but I think it is clear we do need to raise awareness, because I think if people are, the problem we have at the moment is that they often mimic general flu, cold symptoms as well. So you're on the one hand, it could increase the numbers of people significantly if we sort of talk about that. But on the other hand, we do need to get increase the uptake of people who are getting tested as well, because we need to test people, isolate them if they have it, to stop the chain of transmission. So it is something. It is an interesting looking at that at the moment and how that's rolling through. In terms of the flu vaccine, yeah, there's been a bigger push on that as well, and I think we're getting through the process of people being vaccinated. I think we're starting to see slightly higher levels than before in terms of people in different groups being vaccinated, and I know that the government have lowered the age recently for free flu vaccinations as well, and I think we're starting to see the results of that as a few more people are coming through. I think one of the things we have identified is that there have been some, certainly I think in terms of staff members getting flu vaccines, there has been some challenges in getting the vaccine in pharmacies at the moment, and I think we have been ringing around the pharmacies weekly to support our staff in particular in the council to get flu vaccinations. But I do know, I think it was last week's ring round, there was an increase, quite a significant increase across Hartlepool in the number of vaccines available. So I'm hoping that's going to lead to more people being able to take the flu vaccine up as well. But I think it's quite a steady uptake at the moment. I think we are seeing more awareness of the importance of people having a flu vaccine as well.
Great. Thank you, Craig. Nicola, you do have your hand up. Are you wanting to come in with something? No? Okay,
Shane,
great.
I think she's on mute.
Sorry about that. I was just wondering if anybody could give us some information regarding, we talked about the care homes, if they've been having outbreaks that they're not allowed visitors. We're really struggling at the moment because we fall in between a care home and a hospice. So we have a long-term unit and we have a hospice. We had an outbreak back in November, and unfortunately we were told by Public Health that we were not allowed to admit any patients for 28 days from the last positive test. I understand that qualifies for our long-term unit, but I was just wondering if anyone could give me some advice of how it affects us from our hospice point of view, because we're respected on a medical model, and it's just a big issue for us at the moment with admissions.
I think that's probably something to pick up outside of the meeting, actually. If we probably have a discussion about that. But yeah, I can have a chat with you.
That would be great, Craig, because we've spoken to quite a few people and we're not getting any further forward. So if I could contact you, that would be great, Craig.
Yeah.
Brilliant.
Thank you for picking that up, Craig. Tim Butler.
Yes, thank you. It's just a question in response, or a comment in response to the question on long COVID. NHS England has put money forward through the networks and senates on the development of long COVID pathways. Referral criteria have been distributed, so there's clear referral criteria to go into these clinics. At the moment, they've all largely been organised through respiratory clinics and secondary care, but there's emphasis on, as Fiona said, the multidisciplinary aspects of those clinics. So funding has been made available in each region. It is being distributed and the clinical pathways have been developed. It's still patchy at the moment, so they're only setting them up at the moment because those documents came through to me literally in the last 2 weeks. As well as that, we're in discussions with the mental health trusts to make sure we have mental health support regarding long COVID as well, because there's a big overlap. So just a little update on that issue. Thank you.
Thank you very much. Thank you for that update, Craig, and thank you everybody for your input today and on this agenda item and all of the others as well. I don't have any other business today other than I received a letter very late last night from Mr. Riley, in which he's raised some of his concerns around the government's response to COVID. There's nothing for me really to bring up here as part of this meeting under any other business, but I will pass that on to relevant partners to have a look at before we send a response. What's this? Sorry. Oh, sorry. John's just passing me something. All right. Okay. Sorry, I've just been reliably informed by John that the meeting of the Outbreak Engagement Board on the 11th of December does have an agenda item in relation to the COVID-19 Community Champions, and that's going to be a presentation from the Director of Adult and Community-Based Services for those who may be interested. Right, thank you all very much. The next meeting is the 1st of March 2021. If I don't see you before, have a lovely Christmas and all the best for next year. Thank you.